Hello everybody, I'm Dr. Sreekumar, dental surgeon, implantologist and maxillo-facial surgeon. I'm here today to clear some very common misconceptions associated with dental implants. Myth number one is that all dental prostheses are dental implants. Not true. A dental implant is a medical device that is surgically implanted into the bone on which a crown or a bridge is given. Many patients who come to me say that they have a dental implant, but when I do a clinical examination, I find that it is a filling or a crown or a bridge which is given on natural teeth. So as I told you, a dental implant is a medical device and not all dental prostheses come under this category. Myth number two. Dental implant procedure is painful. Again, not true. Dental implant procedure can be done very comfortably under local anesthesia. It is quite painless. And for people who are a bit anxious, we have an option of doing the procedure under conscious sedation. Myth number three is that dental implants are a failure for elderly people. As a fact, most number of dental implants are being placed for elderly people because that is the time when dental implants are necessary. But there are a few medical conditions that we need to consider before doing dental implants. The most common being uncontrolled diabetes, chemotherapy, and a few bone disorders. Myth number four is the only criteria that decides implant success is the brand of the implant. Again, not true. The selection of a brand of implant is something that we do for you, and if at all there is a choice that you need to take, we will present it to you. So you don't need to worry about the brand because it is something that we take the responsibility and provide for you. Myth number five is a dental implant procedure can be chosen by you after doing only online research. Again, not true. You have to base your decision after doing online research and also taking a few expert opinions through referrals or in person with an expert in the field. This will give you the highest possibility to have a good dental implant treatment. So, thank you so much, and please get in touch with me if you have any queries regarding this. Thank you.